Dr. Krishna Reddy Nallamalla, Regional Director, Access Health International South Asia Regional Office. The resilience is the concept simply how a system absorbs when a shock happens or a crisis happens and recovers from it without much damage. This originally was among the natural disasters, cyclones, earthquakes, but now it is extended to health systems, the whole concept of resilience, how health systems absorb a health shock and how do they recover, how quickly they recover, and when they recover, how they improve themselves so that in future they can absorb the shock. So, as a part of resilience, there are now steps not only just absorb when there is a shock, but how do you prevent that shock? Just like we call how to prevent heart stroke, how to prevent brain stroke. At a system level also, now there is a mechanism to prevent health shocks because we know which organisms have the potential to cause pandemics, which organisms can cause epidemics, which climate or natural disasters can lead to health crisis, like a lot of migration is happening, people in the war zones, and when they go to camps, refugee camps, they end up with like Rohingya, they are displaced people, they are living in camps. They are getting into variety of diarrheal illnesses, cholera illnesses, the system is not geared for that. So, given this situation, how the health system should get prepared for the future? One is the prevention of that. Similarly, the labs are experimenting on microbes. If there is a leak, is there enough biosafety in the biotechnology labs, in the microbiological labs? Then you also have urbanization pushing people into the forestry, the wildlife. So, how do you prevent that intermingling of the wildlife and the civil society? Then we also have science advances because of the genomic advances. You can know how many organisms are one mutation away from jumping to humans, from animals to humans. So, there are about 14 organisms identified. So, you can prepare actually a PCR diagnostic test for these organisms ready. When it actually arises, you should not be struggling to raise that one. The same way vaccine platforms, at least the pilots can be done on some of the vaccine candidates. I mean, just like for SARS, because SARS-1 we had, there were platforms working on SARS. So, it came handy when the COVID struck because the virus is same, it is the same coronavirus. So, this preparedness, the preventionness of these potential crises, both climate related or geopolitical conflict related or microbiological pandemic related. So, that is a prevention component. The second is how the systems are prepared. For example, if we have beds today and they are already say 80% occupied, and if there is a sudden demand of 2 times more demand for beds or 3 times more demand for the beds, how do you arrange them? But the challenges, the challenges I see in implementing these policy reforms, the human resource capacity, the competency levels. See, one of the key requirements, we have medical professionals, we have nursing professionals, we have dental professionals. There is a standardized mechanism to produce these professionals. But who is managing this entire complex health systems? There is no defined health manager. Everybody is offering some health management course, but are there standards in health management science, which includes health finance management, health quality management, health information management, health insurance management. So, we need people with competencies to manage these complex systems, including public health management. Yeah, so Access Health International was founded in 2007. It was founded in India as a concept but established as a legal entity in the US. It is a health systems think tank, so it undertakes 5 work streams as a part of health systems think tank. It undertakes research to inform policy, its formulation and its implementation. It undertakes capacity building in terms of individual training as well as institutional capacities. It undertakes advisory work in diagnosing a problem and also coming up with strategic plans to address that problem. And it engages stakeholders in advocacy of some of the ideas to strengthen the health systems. And finally, the 5th work stream is it creates public awareness so that it can empower the people to know about what they should ask. So, as a part of our activities, one of the major activity I would say was health policy research and analysis, which we undertook in 2018 and 19. That was compiled into 8 to 12 adoptable solutions. In fact, it was published as a report by Niti Aayog in 2019. So, that was one of the major contribution into policy formulation. It involved global researchers, Indian researchers, close to 150 researchers. They studied our financing system, they studied our provider system, they looked into our information system, and then at a whole system level, what are the actionable solutions which the government or the health system can look into. So, I would say that is one of the major activity that Access Health undertook in India. So, Access Health is now supporting the implementation of the major policies towards health system strengthening and building the resilience. So, it supports through research, capacity building and technical support to the various implementing bodies both at central level as well as some of the state levels. For example, we provide the technical support to the UP government in implementing the PMJ. We are also in partnership with National Health Authority in implementing 2 flagship reforms, that is PMJ as well as Ayushman Bharat Digital Mission. Yeah, our future plans are to actually bring together all these things onto single platform called Global Learning Collaborative for Health Systems Resilience. So, here we try to bring various stakeholders and take them through a learning process of knowledge compilation, then practitioners' insights, lessons from the implementation and experiences, then putting them into kind of a learning content. And some of these learnings, we look at whether they are actionable learnings, pilot these learnings, and then again learn from these pilots what is working and what is not working, and then disseminate and nurture this as a culture of learning health systems. It is across the world, at a global level, at a national level, at a subnational level, and at a local level, as local as at a village or a municipal board. So, this is our future dream of compiling all these works into one platform.